So we've done a couple podcasts on red light, but as an office, we are doubling down on red light because we have seen such amazing, drastic changes in people's health, and we're just really excited to kind of move into kind of not a different direction, but a heavier focus on red light and all the abilities and capabilities that it's offering. So let's dig in to what red light therapy is.
So we can start super simple and say that red light therapy is like sunlight's smarter cousin. In the way that, and this is a question I think we get all the time, when we think of sunlight, you're thinking of the full spectrum of wavelengths, right? Including UV rays, which could sometimes pose concern, right? Sunburn, we talk about those UV rays. So with red light is highly concentrated in therapeutic doses of wavelengths without all of those harmful side effects. So no UV rays, but really laser focused on the therapeutic wavelengths that get us our desired benefit.
Yes, and those are very specific wavelengths.
Mm-hmm.
But before we get into the nerdy science stuff, it works on a ton of different levels, right? And so because we're using light to basically affect the mitochondria, the powerhouses of the cells, that can have many different effects. And so primarily in our office, we're using it for skin tightening, weight loss, fat reduction. But we have a ton of people that notice many other benefits. In fact, a lot of times during the winter, I'll go in and use it just for uplifting mood.
Right.
We have people improve sleep, brain fog lifts. We have
Seasonal affective
seasonal
disorder.
affective. We have fibromyalgia patients
Yes.
and lower back patients that notice a huge difference in pain levels using the red light therapy. And we don't talk about it a lot to patients because we normally know what they're coming in for based on the initial conversation. But our units have 4 different settings that can really highlight
That's right.
certain frequencies depending on what's happening and going on. And so there's a fat loss, there's a pain, there's a circulation, and
Skin. Yes. And you said pain recovery actually goes hand in hand with that. Yes. And when you talk about mitochondria, right? And because not everybody really understands mitochondria, so really to simplify it, each of your cells actually contains a little battery inside each of those cells, and that's your mitochondria. So when your battery is not charged, it can slow everything down. Your metabolism, your healing processes, and even just like you said, your mood.
Yeah, I mean, there's I can't think of a single bodily function, hormone, anything that's not affected by how well your mitochondrial are working. It's been a huge, the last couple of years, probably at least definitely the last 5 years, but certainly before then, mitochondrial health has really taken like a forefront, and it's almost like a big buzzword, and a lot of people don't really understand what that means. And so there's a lot of things that affect mitochondria, but this is one of the easiest, fastest, safest ways to improve mitochondrial function and health that makes a huge impact in, tons of different systems. Today we're going to focus on the kind of skin tightening and fat reduction component. but I'm sure we'll do future podcasts that we can isolate just the skin. We can just isolate the circulation. We can just isolate the pain and recovery modalities. But yeah, definitely today let's focus on the skin and fat loss component.
So the fat loss component is incredible because the technology itself, and again, very different from sunlight, which is we're only getting that, surface level. But when we're really using concentrated laser focus, right, same dose, same consistency, our infrared, which contains near infrared and red light actually to penetrate the skin 8 millimeters deep, to actually target and go right to the center of those fat cells. And the truth is it's the only technology that we know to date that can actually do this, right? So nothing else is going to the center of those fat cells and liberating that cell of its toxicity. So what's happening is the infrared is penetrating the skin 8 millimeters deep, hitting the center of that fat cell, heating up and liquefying the contents in that cell. You ask me what contents, we're talking toxins, triglycerides, cholesterol. And what happens is that cell, as it heats up and liquefies, it starts to expand. They call it transpository diffusion. So the cell expands to where that cell wall starts to weaken. And I tell people it's like, it becomes like a little colander, right? So if you think of your fat cells like clusters of grapes all over your body, the center of the cell is becoming gelatinous and liquefied and heated, and then you're getting little colander-like perforations in each one of those cells. And for 72 hours after every treatment, you're leaking over toxins, triglycerides, and cholesterol over that cell wall into interstitial spaces of your body, and you're excreting them through urine, sweat, and bowel movement.
Which results in those fat cells dramatically reducing in size.
That's right. They shrink down to the size of a raisin, and they do leave their shell behind and intact for a good reason. We don't destroy tissue. We have a lot of people who come in who have tried it all, right? There's other methods. There's cool sculpting and cryo, and people are always asking me what are the differences and those types of treatments. And for reason of feeling sculpted out, aesthetically appealing to where it's all over the body, and you're not just getting spot reduction in some areas. So one spot is treated and the other spot isn't. It prevents that type of a distorted type of a look in the body, right? We don't want that. We don't want other areas, completely annihilating the fat cells so there's no return. And then, if we do have an event where we do need to absorb toxicity, it's coming in cells around that area. So
yeah, your body's intelligent. It knows what to do.
Yes.
This is just allowing it to excrete and get rid of those things in a more natural way instead of killing and scraping and physically removing those cells.
That's right.
This is shrinking them.
That's right.
By eliminating what's inside those cells.
That's right.
The other big component of red light therapy that we see a ton. So when people come in, they do a 3D body scan, and part of what we're looking for is initially where are we starting at, right? Like BMI and what's their percent body fat and what's their percent lean mass, and over the course of sessions and treatments, we want to see significant improvements in those areas. But what we notice is, contrary to a lot of other strictly just losing weight, is the red light therapy is helping to tighten loose skin as it's reducing inches. So it's not just about seeing an overall inch reduction. We see a lot of people, we want to see the skin tighten.
That's right.
We want to increase collagen and elastin in those skin cells so that as they're losing the weight, as those fat cells are getting smaller, they're also seeing a firming and a tightening up, which we see crazy changes on the body scans.
Crazy changes.
Doing that.
Yes.
In fact, we also have, the GLP-1s right now.
Mm-hmm.
Tons of people are on those, and they'll come in and use the red light therapy in conjunction with making those changes because we want to preserve lean body mass. And so you should have some help navigating
Yes.
that concern.
Red light therapy does enhance lean body mass.
And so as you're losing the weight, instead of just trying to figure out how to tighten skin after you've lost all this weight,
That's right.
you're going to see much bigger and better and much more drastic changes
Yes.
if you're tightening the skin as you're losing the weight.
That's right.
Because we've seen it both ways, where we've seen people who've lost 100 pounds and they've got a ton of excess skin,
Sagging skin. Lots
arms,
of texture changes.
Yep.
Yes.
And remarkable differences after 8 to 16 sessions of red light therapy with those types of patients. But the people who are the happiest are the ones who are getting red light therapy while they're losing, because then they don't have those issues in the first place.
Exactly.
Or
They're
less.
That's right. They're not having to go, back after losing all that weight and then figure out what am I going to do with this excess sagging skin, because it's just done simultaneously, which is beautiful. And I want to add on that too, because even people who are really, putting icing on the cake, like it's really exciting to see people come in who have, they're doing what they can do. Right. But there's just those really stubborn spaces. And we see that all the time. People will tell me, I just can't get rid of my saddlebags. And all I want to do is feel really comfortable in a bikini this summer. And it's really incredible to watch, but almost just like our scans back up that. And I want to touch on that lean body mass and metabolism again, too, with the GLP-1s. Please don't let me forget. But it is very exciting to start to see that sculpted out, smoothed out. Like the infrared definitely takes care of all of that. So it looks like on the scan, we look at it and we're like, oh, it looks like they've had work done, and we get excited about that because you visibly see it.
Well, yeah. You were showing me the one scan. The lady looked like she had a butt lift.
It really looks like that.
And,
yes.
Now she's excited to hit the beach this summer.
That's right.
Because she feels a lot more confident in that.
That's right.
And, honestly, that's what we get way more excited about.
So fun.
Like, obviously, we want, if someone needs to lose weight, there's a million bazillion health reasons why we know that that's important. But besides looking at people's blood result tests get better and off medications, and for every pound you lose, you're going to lose 3 or 4 pounds of pressure off of your joints. Besides that, the mental and psychological changes that you see.
Yeah, the confidence and the self-esteem, and just that the thing that we do when finally we realize like we're something to be leaned into and loved and not something to be conquered, right? Like it just gets really exciting, just finding that place again. I always tell people my goal is that I really want you obsessed with yourself. That's really my goal. So, yeah.
And it doesn't have to be something like you beat yourself up.
Oh.
Right?
Oh. Right? And actually that's what we're really trying to unhook, right? We're trying to unhook all of those limiting thoughts, all of those things that, keep us, in this pattern of honestly, it's devastating, right? Like, shame has no room here. Like, I tell people, nobody ever made any long lasting results by being made to feel bad about themselves. We're going to do this without deprivation. We're going to do it without restriction. We're going to do it with joy. We're going to do it with intention. But most of all, we do it in freedom.
And so, yes, we're not doing it by forced and guilt and all the negative reasons. The other side of that that fucking drives me crazy is the social media posts and the emails that I get, because everyone's doing red light now, and it's like, you don't have to do anything, just come lay on the beds and you're going to lose all these inches. And we're really sorry to tell you this, but one red light session is not going to fix you before vacation.
No.
And you also have to make other lifestyle changes in conjunction with using the red lights to actually get the results you want to see.
That's correct.
So regardless of what you see on Facebook and Instagram, whatever people are sending this stuff around,
that's right.
It's a lie. They're trying to get you in there and just
that's right.
hook you on a membership.
That's right. Without really any outcome.
No. There's not going to be any coaching. You're going to get frustrated because you're not seeing the results that you want to get. The process is simple but not easy. You do have to make other health decisions along with red light.
That's right.
Red light is not a fix for just going and eat whatever the hell you want to eat.
Right. You're right.
It's just like exercise is the same way. You can't just go out and eat whatever you want, go to the gym once a week for 20 minutes, and you magically look amazing before your next trip. Like, it's not going to work that way.
It doesn't work that way, especially if you understand the science behind how infrared works, and you understand that once those cells actually start leaking into interstitial spaces of the body, it's going to activate your lymphatic system. And your lymphatic system, guess what? Shunts itself into your liver. And if your liver is hung up trying to emulsify unhealthy fat from your diet, guess what it's not going to be available to do? It's not going to be available to mobilize and emulsify fat from the offload of toxicity that the infrared did in the first place. I think that's important to know.
And if, again, we're getting geeky here. Let's say you remove this fat with red light therapy. If your insulin's high, and you're eating tons of carbs and sugars, and you're just forcing all this glucose back into the fat cell, your net gain's not going to be there.
That's right.
To see the overall reduction over time.
That's right.
So, sorry, that was a soapbox that's been driving me nuts for a long time, but it's true. People have to understand. These are very. Technology is amazing.
Yes.
But it's not a quick fix, and it's not a magic bullet to be able to just go eat whatever you want.
That's right. And this is a partnership. When people come to work with us, it is a partnership, and it does require them to be an active participant in their care, right? And take ownership of that.
Absolutely. And the other factor is, we talked about wavelengths and the importance of what certain wavelengths are doing. Mm-hmm. My other caution to people as you're looking into red light therapy is the $50 unit that you're getting on Amazon is definitely not the same unit that you're going to get in a professional setting.
That's right.
The wavelengths are completely different. The intensity and how the depth that those lights are going to be able to go, completely different. The devices that we're using are FDA cleared. They've been researched. You can only get them in a professional setting for a reason, because they're super powerful and they work really well. But you have to know what you're doing with them, and you're not going to be able to just get them
On Amazon?
on Amazon
Mm.
or
Mm-hmm.
really many other places unless you're a professional.
That's right.
So walk people through a little bit about when somebody comes in, how do we determine what they're really like, what we're recommending as far as, do they need one session or do they need 100 sessions?
Right. I would say most people, minimum, it's 8 sessions that they need. And then even once we start moving in that direction where it's twice a week, over 4 weeks, we want the consistency. The consistency
And that's going to be
is
the
important.
person who is already fairly lean.
That's right.
They're just looking to lose a couple inches.
That's right.
Tighten up.
That's right.
And they want to look good before their vacation
Right.
next month.
And even then, really taking a look at how we're actually toning and tightening and reducing inches in certain areas. Some stubborn places definitely take a lot longer, right? Like, so talking about, just making sure that, I know it sounds really funny, but as, just even, I'll make that. So someone who was wearing a backless dress who was trying to get ready for a wedding, and we had noticed, like, okay, you know what, there are some bulges there that weren't there before in the back that was making, her pretty uncomfortable. And we got in, and our 8th session, we saw such a huge reduction, but we could tell that there was just more to go. Like, it would just make her feel so much more confident and comfortable to be able to wear it if it wasn't there at all. And we achieved it, right? It took 16 sessions to do that, though. So it just actually depends on, that's why we track with the scanner too, because you can see it all.
Yeah, and the scanners, so typically when someone comes in, we do a 3D body scan, and it's taking,
Oh my goodness.
how many measurements? At least 30.
More measurements, because each region.
Their basic scan is maybe 30.
Yes, and overall surface volume, you get so many measurements.
Yeah, and so we want to line up what the scan is showing us with what they're hoping, and then we can start to mirror what those expectations,
That's
kind of
right.
merge those expectations together.
That's right.
And but we also want to track using the scanner. That's why we do a scan typically once a week, or at least,
That's right.
to make sure that if there's any course correction that needs to happen, it's not gonna. We want it to happen sooner rather than later. We
That's
don't
correct.
want someone to wait a month or 6 weeks before we start to make those adjustments and changes. We can make that week to week, in line with other coaching and food and dietary recommendations, based on what they have coming up, and so we combine all of that into a program. And so yes, we use red lights. We have people that come in and just use red lights, but you're going to get much faster and longer lasting and better results if you are combining it with kind of a more holistic approach.
Yes.
So if you're talking to somebody who's really on the fence, I've heard about this red light thing, but I really am not sure if it's the right thing for me. Kind of, what do you say to them?
Sure. Well, first of all, if you've never experienced it before, there is going to be, right, an air of, what is this? There may be doubt, there may be hesitation, and I say that all belongs, especially if you're unfamiliar with the technology. So one, I would say, Great. I'm glad you're here listening to this podcast because it's very informative and it's going to really give you information on what to expect out of it and what it's doing, right? I say also, when somebody comes in, the one thing we can't argue with is we cannot argue with the results that our patients are getting. You can argue with everything else, but once you see the before and afters, not just in the scan, but in the blood work, I mean, it's just, it just comes down to are you in a place where you're ready to do this work and make that type of a time commitment to it? Because it does work, right?
Yep, we see people that they feel better, they look better on the scans, they're more happy with how they look.
Right.
And internally, we can see huge changes in their blood work and overall inflammation markers.
Yes.
It's awesome. So, if you have questions on red light therapy, if it's the right fit, and if any questions about the program that we offer and how we kind of combine everything together, feel free to leave a comment below, reach out to us. We are here to educate and really just help you however we can. Until next time, have a great day.